And in your medical and your hospital coverage, you buy that insurance?
No, I think that's always been covered.
Covered by?
The government.
The government.
Yeah, by the government, I guess. It's not a thing I think about. As a small business owner, healthcare is not on my list of the things that I worry about. It's such a small part of our bottom line. We probably spend more money on movies than we do on healthcare in a year.
In Edmonton, we have 125 employees. In total, just over 200 in all of Western Canada. The healthcare premiums are covered by the public health program.
Healthcare is free to everyone in Canada. Most companies, though, will have an extra plan that will handle extended Medicare, and that would be for ambulance, dental, optical, prescriptions.
Our costs on a monthly basis are over $48,000 a month to cover, the dental plans, the drug, the additional benefits we have, and also that includes the RSP and life insurance.
We have a lot of small entrepreneur opportunities up here. In Canada, I think it's something like 80% of people are employed by small business.
I do have some vision problems that I've had since I was a child, so I've always needed a specialist. The surgeon I first had as a teenager, his son is actually my surgeon now.
Everyone in Canada has equal benefits, so it doesn't matter if someone is very rich or if someone is homeless and on the street. Everyone gets the same basic health care.
Knee replacements, hip replacements, things like that that affect quality of life but aren't live or die. Those are tougher ones up here because there's a lot of demand for them and they're just not as urgent.
From my standpoint, I wouldn't mind waiting a little while when I don't have to pay a damn thing. I had a very strained back here about a month ago. A quick call to the doctor had me in the next morning. X-rays all within hours and prognosis very quickly. With the finest care that you'd ever want to have, and I didn't pay a nickel.
We end up paying it in, personal taxes and corporate taxes and things like that. Money's got to come from somewhere.
I was at the golf course the other day in Phoenix and had a conversation with a lady who said, I don't want to have public health care. I don't want to be supporting all those poor people. And I fell over because when we in Canada, we don't think that way. But if that lady said it, it makes you wonder, doesn't it, just how many have that feeling towards public health care.
I'm not sure what the resistance is to that care and service.
I'm a big fan of what we've got in Canada. I can't say if that's because it's necessarily better for business. I just know that in our family, we've got 2 young kids, and the excellent care that we got when we had those kids in our public hospital and the follow-up and health services, that kind of stuff, especially as a parent, is something that I really value. I couldn't imagine living in a place where you have to make health decisions for financial reasons. We'd find a way to pay for it if there was something that we had to pay for it realistically, because we're parents, who knows what ends of the earth you'd go to. But to be able to go in because we're concerned is a positive.
We live a life of great freedom, and we can do what we want, and we have the greatest health care. I feel very proud as a Canadian to be able to support the people that don't have the resources.
What's the impact on you of deductibles, co-pays, co-insurance, premiums?
I don't know what a copay is.
I've never heard of a single payer.
I don't know what single payer healthcare is. What is single payer healthcare? What is that?